I'm Matt, this is Natalie. We're going to do some joint mobilizations starting with the tibiofemoral joint. So working from Maitland grade 1, I'm going to take the joint, and the first grade of mobilization is just in the beginning of the range, and there really shouldn't be much translation whatsoever. So I'm going to grasp the femur and the top of the tibia and gently, very gently, just produce a little bit of oscillation there. This is only for pain relief. And she's pretty lax, so actually I have to really ease up and not produce much force at all, or else I'll start actually translating the joint. As we move into grade 2, a slight amount of translation does occur with a little bit more force. The same result is desired, is pain relief. Now into grade 3, we're going to move farther into the range and get into a little bit of a stretch in the ligaments there. And then grade 4, as far as we can go without cracking it. And this requires a good amount of force on this joint. So, in the second finger, MCP, it's a much smaller joint obviously, and it's going to require a lot less force. So as we go backwards on it, even with just a little bit of force, I can translate the joint. So a first degree joint mobilization is just very slight amounts of force. A couple ounces is all you need. Second degree, same progression, a little bit more. Third degree, we come into the end range and start to press against the ligaments full capacity. Fourth degree, we go all the way, and it's difficult to keep it from fully translating and subluxing, but you gotta do your best because we're not supposed to do that. So now we go to the shoulder, the glenohumeral. It's a larger joint like the knee is, but as it doesn't have as many bony blocks, it's going to be similar in force production, the amount of force that you need to translate it as the finger, especially when the patient is fully relaxed. So I'm going to have her grasp my shoulder. I can grab her like this, and for a first degree, very slight pressing in, or we can go down either direction, very slightly. Second degree, a little bit more force. Third degree, more. And by the time I get to the fourth degree, I'm pressing forward and pulling back with my other arm, but not nearly as much force as is required to move the knee joint. And that's all.